Good morning, everybody. Welcome to our training and orientation Connecticut DMHAS Resource Link Governors Prevention Partnership, GPP. We're very thankful and grateful to our resource partners that are with us today to provide this presentation to you. I'm Jen Jacobson with TTAS, the Connecticut Training and Technical Assistance Service Center. Happy to be the host today. And if you have any questions, by all means, please feel free to use the chat along the way. I'll monitor that for our guests today and let them know if any questions or comments pop up. But we will get going, and I'm going to turn this over to our partners to introduce themselves and get going with today's training. So, Deb, if you guys want to take it away.
Roland, I'll pass it to you.
Oh, sure. So, good afternoon, everyone. Roland Harmon and Kelly Jewson here with co-presidents with the Governor's Prevention Partnership. We're really excited to be able to share with you a little of who we are. We won't get too much into the weeds. We will just give you a snapshot of who we are, what we're all about, what our journey has been over these years, and just recognize right now that we are just we're thankful to have the opportunity to be able to serve as servant leaders here in this space across the state of Connecticut, ensuring that young people are protected from the threats of drugs and alcohol. And that's really been, our theme for the past 36 years here at the Governor's Prevention Partnership. And just a shout out to all of you for taking the time out to hear a little about who we are, but specifically to our folks at DMHAS who are leading the charge, leading the resource links, leading the prevention movement, to the program director, the prevention director, Sarju Shaw, and to Stephanie. And we see them here today. And so we just thank you for your leadership and how you are corralling us all together to make sure that we're supporting youth and families across Connecticut with the most timely resources and information so that we can prevent drug use before it starts. So we really appreciate this opportunity to be before you today. If we could go to the next slide, Deb. The Governor's Prevention, today what we intend to do here today is just really focus on three core objectives, three various conversation topics. You'll learn about who we are and how we connect with the prevention infrastructure and how our time has been spent in that space. You'll hear about the services that we offer in a couple of buckets and what we've done over the past few years. And we'll be able to give you some resources on how to connect with us and access some of our services and supports within the Governor's Prevention Partnership. We're going to kick off with a video here that just shared a little bit about at a high level who we are. This was featured at our 35th anniversary, our 35th celebration last November. And Deb, we can go ahead and get this started.
In 1989, Governor William O'Neill co-founded the Governor's Prevention Partnership, then named Drugs Don't Work, a public-private partnership, combining business and government resources to help prevent substance misuse for Connecticut's future workforce. Through 35 years, co-chaired by 6 governors and business leaders, programs and resources made available have provided positive opportunities for young people across our state.
GPP has given us the opportunity to be champion in our own city. GPP helped give us the curriculum for kids to engage in activities around drug prevention. It's about empowering the kids and reminding them that they are the ones who make the choices. Studies showed that most of the young people are getting them out of the medicine cabinet. We're really trying to help young people to be better equipped.
What we need to do is continue our part in educating folks, and I think we're on the right track.
The Norwalk Mentor Program is a school-based mentor program. We are introducing consistent, stable adult role models in a student's life to prevent them to create bad habits. They talk about the importance of school, to be in class. They're teaching them commitment. So as I show up, you show up.
The days of being, kind of naive about drinking or a little bit naive about, using entry, level drugs, those days are gone. And so I think the challenge is to really dig in and to not only mentor and educate, but to really make it personal.
Every kid is different, right? We're all different. Without even thinking about it, I'll adjust my mentorship accordingly. I'm going to educate and advise a young adult in a different manner than you might have in class here. I often say, I'm somebody that you can kind of ask a question that's not your teacher and not your mom or dad or your guardian. You're in a safe place with someone who cares, and if I can help you make the choice that fits you, we both win.
Mentoring is extremely important. You can tell someone a story or you can give advice, but if you're not living the life, if you're not really sharing close personal ties, you're likely not to be understood or listened to.
My high school, Sport and Medical Science Academy, we had a lot of drug-related events. Most notable of them was when a middle schooler passed away from fentanyl. Groups like GPP play a huge role because they often act as a mediator between the students and the teachers in educational settings. Like, a lot of times teachers are not aware of it. Like, I know at my school, the whole possibility of a 13-year-old passing away because of a fentanyl overdose is not something a lot of us thought was very possible. And I think that's really what motivated me to reach out. I joined their youth advisory board as part of the Speakers Bureau group.
I'm testifying to respectfully request
Students from different high schools testified with me. Together, we were able to push a powerful message that something needs to be done about this. It's a very important issue that's almost everywhere in our society, and unless people work together and take serious action against it, it's not going anywhere.
This is what prevention is all about. It's about having a mentor. It's about having a friend, somebody that really cares about you. And that's what the partnership is about.
As we look ahead to our work tomorrow and over the next 35 years, we know that mentoring and caring adults will continue to play a critical role in our state's future. The wise words of Governor O'Neill still ring true today. Prevention is the optimal strategy.
Thank you, Deb. One of the things that, we've been about for the past 35 years has really been centered on youth, right? Youth are in the center of everything that we do. When we were founded 35 years ago 36 years now, by Governor O'Neill, his focus was really on how we are supporting young people to enter the future workforce. We were first started as an organization called Drugs Don't Work. And Governor O'Neill connected with several business leaders of several major corporations and said, okay, we've got this challenge. We want to make sure that young people are able to enter the job market, able to enter the workforce without the threats of drugs and alcohol, without the threats of disconnection, but feel supported and they're ready to build businesses and a healthy life here in Connecticut. And so he contacted several business leaders and said, the state will leverage X amount of dollars in prevention and what we want to, we want this group to be about. And we also need you to leverage that investment as well. So when we first started out, we had a balanced investment that we were bringing forth and leveraging statewide as in terms of resources and dollars towards the prevention infrastructure here in Connecticut. And that was 36 years ago. We've survived the time and have thrived in many ways under 6 different governors, 6 different administrations, whether that's from all the different political parties. And we are one organization. We are a public-private partnership. We are a nonprofit 501c3. A lot of people sometimes think that we are we are a state agency and we're statewide, but we're a public-private partnership that's a nonprofit organization. And you see the number of communities that we have served, that we continue to serve. We want to be of service to all 169 communities across our state, and particularly with the focus on underserved populations as well. Some of our core pieces that we focus on with youth being at the center. We do this in a number of ways. We are a training and technical assistance organization. We are a convener, a thought leader around the issues around youth development, youth programming that centers around prevention, and also youth programming that centers around youth mentoring opportunities. And so we know that mentoring is that individual protective factor, building those positive relationships with young people. The more assets that young people have in their life, we all know that they're less likely to engage in risky behaviors. And so our work has really focused on championing those individual relationships, those mentoring opportunities, lifting up and raising awareness about the benefits of having a mentor in the life of a young person, but also those other adults, that those advisors, those teachers, those coaches that work with young people as well, and providing them with the tools and resources they need to have thoughtful conversations with young people about the dangers of drugs and alcohol, increase their refusal skills, but also understand the threats that our young people are facing as well. Um, and that's one piece, as a capacity builder and as a convener, bringing diverse groups of people together in the same room to talk about what our young people are facing, and how do we create a plan and a path forward to support them so that they are able to enter the workforce and be productive citizens here in our state. Um, in addition to that, we work a lot around public policy and advocacy working. My colleague Kelly is going to talk a lot about that. This is her wheelhouse. And it's raising awareness about the challenges that young people are facing and the benefits of prevention. A lot of times, folks are always looking, legislators in particular, looking for the return on investment. And while that may not be immediate, it's more long term. We at the partnership want to be able to carry that message for that long term investment in prevention, and then those practices that can be turned into policy as well. And then the other piece that we focus a lot on is connecting with the business and corporate community, right? And raising awareness there and inviting them to continue to invest, so that making this investment now in young people and into the future workforce is going to pay off tremendously when individuals are working for your company in terms of profits and sustainability for your business, and making those connections and making those links as well. We are grateful for the funding that we currently have and funding that we've historically had, especially from our state partners and investors. Department of Mental Health and Addiction Services is front and center. They have historically been our main funder for the past 36 years. And so we are grateful for that opportunity to be able to uh, use those dollars and use those resources in shoring up capacity building for the programs and entities that we serve, also extending and building that public-private partnership, and then being that thought leader and convener in this space as well. We've recently received funding from SAMHSA at the federal level, also from OJJDP, Office of Juvenile Justice and Delinquency Prevention, which is under the Department of Justice, for mentoring. They fund a lot of our statewide mentoring initiatives, State Department of Education for mentoring, and also Connecticut Community Foundations and corporate partners. And this allows us to really provide the training and technical assistance that that our partners programs ask for and tell us in terms of what they need to be able to reach more young people. One thing I'll also say is the way that, we're built around collaboration and partnership. Partnership is in our DNA, Governor's Prevention Partnership, right? Well, what does that really mean? And it's bringing people around the table, convening, sharing ideas, communication, collaboration. That is something that, as Kelly and I have stepped into these roles for the past 5 years, that we've really been focusing a lot on. And as we are able to draw down and apply for federal grants or foundation grants, we always want to partner with folks at the local level. It is not our goal to secure dollars and resources and to not share the resources in the community. It is not our goal to compete at the community level for funding opportunities, but to kind of augment or support and share resources at the community level. And collaboration for us is key. We will never apply for a grant without talking to the community and finding out from the community exactly what the community is looking for and what those needs are. Our goal is to align alongside, and not to come in and tell the community exactly what they need as well. So we're going to look at strategic plans. We're going to talk to some of the key partners and the influencers within that community and credible messengers to tell us, because they know what the community needs, how something or a new project or a new opportunity can work to be able to support the efforts that they're already doing. And we do that in a number of ways. There's all the 12 sectors that we partner with at the state level and also at the local level. And then we take all that and we may put in a federal opportunity or a federal grant to say, hey, look, we've got all these partners that are rowing in the same direction, working to solve the same problem. If we have these dollars, this is what we think we can do. And so here's one example where we turn practice into sustainability and policy at the national level. In 2012, we received a grant opportunity from Court Support Services to develop a mentoring model that focused on serving youth involved in juvenile justice. We were able to do that from 2012 up to 2016. In 2016, we got to the point where there was this need that there was a shortage of mentors, which is a problem or a concern everywhere, nationally, everywhere. But we tapped into the strength of young people and the resilience of young people who already have assets in their life. They already have key people in their life who may not, they may not connect with on a regular basis. Well, how do we help young people attach to those individuals in their life to get into formal mentoring programs? So we developed something called youth-initiated mentoring. 2016, what we built from 2012 with our mentoring opportunity with juvenile justice said, hey, this work has been working. This is the need. Pulled all the partners together, and we submitted this federal proposal, and we're able to create a strategy around youth-initiated mentoring, which is now used in other states. But Connecticut, through support from DMHAS, through support from Court Support Services and Juvenile Justice, we were able to create this national model and mentoring strategy for young people, more young people to be served with the assets that were already available to them. So collaboration for us, partnership for us is key. Yes, okay, Deb, thank you. This next piece, our organization has 2 national affiliations, and Kelly's going to talk about our affiliation with CADCA. This one is our affiliation with Mentor. So that's the national leading organization that many states are attached to, where the mentoring practice comes out of. It's research-based, it's evidence-based, it's evidence-informed practice for mentoring strategies that we are able to draw down and say, okay, how are we going to implement that practice here in Connecticut? From a quality assurance perspective for mentoring programs, training and technical assistance, from a funding perspective, even from various campaigns and messaging. A lot of that comes down from our national office. We tweak that, make it specific in Connecticut, then we make it even more specific in the local communities. And so Mentor, the national organization, is now celebrating its 35th anniversary. The Governor's Prevention Partnership was one of the founding members of this organization. And so we're very proud of the work that Connecticut certainly has led in this space. Right now, we serve about 100, provide training and technical assistance to approximately 100 mentoring programs here in the state from different models of mentoring. Community-based, which is like your big brothers, big sisters, or your school-based mentoring program where the mentor shows up in the school on a weekly basis and meets with a young person. And then we took it even a step further, especially with the opioid epidemic. We wanted to make sure that we had tools and resources available to mentors to be able to have conversations with young people, extended from the family having the conversation with young people about the dangers of drugs and alcohol and those threats. And so we've equipped mentors. We are now equipping mentors through training directly for mentors, for training for mentoring program staff to be able to support their young people and their families, engaging the families in many conversations. So it's just another layer of getting information out about prevention. All those key tips, those key helping points that people can glean from, the key tips on what parents may need to do if their young person is engaged in risky behavior, and where to go for resources and supports. We've adapted that here in Connecticut, and other states, again, are now picking up on that. But Connecticut was one of the first ones for youth-initiated mentoring and also for mentoring youth impacted by the opioid epidemic. And I talked a lot about, well, some about our training and technical assistance. There's program development, quality assurance, program improvement. So a program would access our services through what we call, and I believe that's on the next slide, We're affiliated with the National Mentoring Resource Center. They put in a request for training and technical assistance through that. It gets routed to us in Connecticut, and we have staff that are very well versed and experts in evidence-based mentoring practices. So we have a framework similar, uh, like the strategic prevention framework, but we have a framework for mentoring called the Elements of Effective Practice for Mentoring, and it has all the standards and quality assurance metrics, all of that built into it. And we're able to go out and visit with programs and provide on-site consultation. That could be for 6 months, it could be for a year. And what we find in that, as we're monitoring that, we do see improvement in their practices. They're able to serve more youth. More youth are doing better in school. So there's markers, there's metrics that each program has, and we tap right into that. What are you trying to achieve? Are you trying to reduce recidivism? Okay, let's look at your program structures that do that. Are you trying to increase the awareness about drugs and alcohol? Let's make sure you have the program and practices in place to be able to do that. Then there's marketing and communication. Programs need messaging. I'm trying to find mentors. That's one of the biggest things that's happening right now. Pitching it to volunteers, people to give up their time to spend that 1 hour, 2 hours a week with a young person, with their family, to spend quality time with them and lift them up in many ways. Marketing, that piece is very key. Where are you finding mentors at, whether that's in a faith-based organization, whether that's at the place of employment, messaging around that. Programs come to us for that level of support. And then any specialized training that we offer. Youth who are disengaged, not attending school. There are trainings that we provide to program directors around addressing chronic absenteeism, using the mentoring strategy for that, and those types of things. Trauma-informed mentoring practices. We've developed specialized training around that as well too. And this is one piece that we're really proud of that can serve as a resource to all of you here today who are interacting and working with youth and families. You may know of a young person in your life, in your program, that could benefit from support from a mentor. You may know of youth who have asked for someone to be in their life, another positive role model. We've created this statewide opportunity. It's a referral portal where people can just go to Mentor Me CT right on our website, and they can click on that, and you can put in the individual's name, their parents' name, their contact information, and you can also select a program in that local community that you want to be able to refer that young person to as well. And then our team will make that connection and bridge that link to that local program, whether that's a Big Brothers Big Sisters or an urban league. We will help you make that connection. We will help that family make that connection to get that the young person enrolled in a program so that they can have a mentor in their life. And I'll turn it over to my partner in success, Kelly.
Thanks, Roland. Before we get going and move away from mentoring, does anyone have any questions for Roland about the work that we do in mentoring and how we might be able to better serve you and your communities?
Yes, Caitlin.
Hi, yes. I'm curious. I work for an LPC, and I'm curious on the back end. Are there contacts we can get in touch with to understand what existing mentoring programs exist in our geographic area?
Yes. So there's a couple ways to do that. One is on our website. We do have a listing of all the programs that are across the state of Connecticut. And you can put in the name of the town, and it will pop up those programs that are right within your area. We also, Caitlin, have we convene small regional groups. They're called mentoring hubs or mentoring collaboratives. So we have one that convenes for the greater Hartford region, one in the greater Bridgeport region, one in the greater New Haven region. And these are groups of 15 to 20 programs that get together frequently and talk about the needs in their community. And so that's another way to get connected as well. And lastly, you can call our office and our team will, you looking for a mentoring program in a particular area, our team will be able to help you and guide you through that as well.
Magdalene, did you have your hand raised? You want to ask a question?
Yes. So hi, my name is Magdalene with Wheeler Clinic. So my question is about the trainings that you offer. How do we get one started
Yep.
What is like the process to get a training started? And also, can you also break down like what things you train staff different staff on?
Yes. So that's a good question. So we have trainings that are listed on our website, different types of trainings. One, there's a core training of, so say a person wants to start a mentoring program. There's like 7 or 8 trainings that we walk them through right on our website. Dates, times, all that is up there. You can register. And we now offer CEUs for all of those trainings. There's a small fee, but we offer those CEUs. Then there are trainings that are more advanced trainings, whether those trainings would be one, I think I mentioned the trauma informed training. Um, there's and there's a couple of other advanced trainings that are just not coming to mind right now that people also register for. There was a training that we were doing for um, specialized mentor recruitment, which is a little bit more advanced. It could, and also grant making, grant seeking, resource development for mentoring programs as well. So those are some of the advanced trainings. All those will be on our website. The other thing is organizations can call us and say, hey, look, I have a team of people or I have a community of people and I need this specialized training. Can you all do this? So we do training for fee for service or specialized consultation for communities as well. And we can tailor training specifically for that community. Some trainings can be offered at no cost through the National Mentoring Resource Center. A community or a program can go through that process. We can come out and do an assessment and determine what types of training folks need.
Okay.
Does that answer your question, Magdalene?
Yes, yes, it did. I just have one more
Yeah.
question. In terms of just presenting about your organization, kind of like what you're doing right now. So I run a stakeholders group in
Yep.
Southington
Yep.
that involves behavioral health professionals and those in the social service
Yep.
realm, and we do different presentations on different topics every other month. I was wondering. One, is there anybody able to that I can connect with that can come and present to the group about the wonderful things you guys are doing? And if so, is there a fee to that person coming to present?
Yes, we can do that. What community are you in? Tell me the name of the community.
So it's Southington, Connecticut. So I'm the coordinator for the Southington Community Health Outreach
Yep.
program through Wheeler Clinic, and we have a stakeholders group in within that as well too.
We can definitely do that. A presentation and just to come and connect and talk about you. There's no cost for that.
Okay, yeah.
Yeah, there's definitely no cost for that. What comes out of that, if folks need specialized support and that sort of thing, of course,
Training.
we come to the table for that and
Okay.
we agree on what's needed. But
Okay.
yeah, we have team members. Deb is here. She has her team. That's what they do. And what I failed to mention when we do a lot of the collaboration piece, we have really tried to be very intentional in stepping up our connection within the community. Whether we're going to tabling events, whether we're going to any events that we get invited to at the local level, to be able to show up, right, and add value in ways that are within our wheelhouse and what we're asked to do and called to do and how we can be supportive. And it's thanks to Kelly, my counterpart, and really pushing our organization in that way and being intentional about that within these last couple of years. So we're very proud of that, but we there's more we can be doing. So if you invite us, we will come.
Okay.
We
Who should I who should I reach
we
out
will
to?
come. And with their gift, we will do that too. We have resources and tools, and
Yes.
about another a resource soon that Kelly has been leading to disseminate across the state. When we have resources and tools, we will bring them to the community as well. So
Wonderful.
call on us, we'll be there.
Wonderful. Thank you so much.
All right, were there any other questions for Roland on how we can help with mentoring?
Maureen, did you have a question?
Yes, I did. So we have multiple programs. I work for New Canaan Cares. So we have multiple programs where we have high school students come in to work with younger kids after school. I was wondering if these trainings were appropriate for high school kids, because it would be nice for, these are through some of the high school organizations.
Yeah.
So I'm wondering if there, because it'd be nice for them to have an hour of training that they could also, they're service organizations. So
Yes.
and that might help them when they walk into the classroom to feel more confident with the kids.
Absolutely. So yes, we do have training for youth as well. We have a peer-to-peer mentoring model. And there are some schools across the state. West Hartford Public Schools is one of the lead mentoring programs in peer-to-peer mentoring, where the high school students mentor in the middle school or in the elementary school. But in addition to that, we also have youth programming and training and support that Deb and her team leads. We have an E3 program, right, where youth are their voice is centered, but they are actually leading the prevention efforts and the communication and all of that at the school level or at the community level. And there's a lot of supports. When you heard in the video, the lady Doreen, she was the first one who said, I received resources from GPP and they helped our young people do X, Y, and Z. She's a testament of the support that we've provided to her group in the city of New Haven, and youth are now leading in that way, carrying the message, but it's from the training that they've received. So yes, we train adults. That's mainly our focus. Parents, uh, corporate leaders, and then also young people as well. And we have the Youth Advisory Board. You'll hear about that. So we do have a lot of resources and support for young people.
Okay, thank you very much.
Okay, so Mark, you have two questions. I saw one come through. Now I see another. Mark Nickel.
Yes. No, I was just based on your experience. Could you just tell us how these, local mentoring partnerships kind of grow, what success looks like, so that we get a sense of how long this takes, or, is it 5 young people? Is it 100 young people? And then the other question is related to the policy and funding environment and the shift toward disconnected youth and building youth leadership core initiatives, and how mentoring maybe can be or is already connected to those efforts.
Sure, I'll start with the first one, and then I'll defer to the policy shifts with my colleague Kelly. So in terms of, it depends. So in terms of a program getting started, it looks different it looks different for a community. It looks different for a program or an entity, whether they're starting a program or they're expanding what they already do. Our team goes in, once they reach out to us, our team does a full blown out assessment of, if it's a program that's existing, what that structure looks like, what their goals were. It's a full assessment that we do. And then from there, we begin building what our role would be with them in terms of training and capacity building and consultation over time. And so and then for new programs that come to us, we want to walk them through to make sure that they have all their goals, their mission, their vision, all their governance structure, all of that in place, their theory of change, all of those different things that make a good program run efficiently. We work with them to be able to establish and set all that up. We do encourage programs to start small and grow over time, and not start out with 100 mentors or mentees. And we also look at what the profile of that community is, in terms of, like, where are they going to get mentors from? Are there other programs that are providing a similar service? We want to make sure that there's no duplication and overlap of services. So there's a lot of things that we walk them through. So it can take, on average, for a new program that's starting, they can be up and running in a year. And a lot of times folks will come to us, they already have been doing mentoring, but it's not formalized. So that's why I say they can be up and running in a year. The program, it's a person that's just starting out from scratch, no funding, none of that, it may take up to 2 years. For programs that are more established and want to grow and expand, we see that it's a number of things, and the time frame can be very different, because depends on how big it could be. They could be embedded in a large organization, and that organization may have to, it's like turning the Titanic. And so there are a lot of systems and structures that have to be taken into consideration. Or it may be this one person who's embedded and just running the organization. They can pivot quickly. So that also depends. So We just did through a legislative allocation. We had some funding from the Connecticut legislature. We called it Connecticut Mentoring Fund. I want to say approximately 18 programs were put through. They applied for funding, got funding. Our team members worked with them, provided technical assistance and training. Those 18 programs had progress and had results that expanded the number of youth that they were serving within an 18-month period, a 12 to 18-month period. So that, again, these were programs that were already established. I think there were one or two that were new programs, but when we look at everything in its totality, those programs were able to move the needle in terms of the number of youth they wanted to serve and build their capacity to be able to do that. And that was the focus, and we had specific funding to be able to do that. And Kelly was instrumental in getting those dollars and the resources from the legislature when we talk about engaging legislators, policy, and practice. And she can take this next question and what that looks like.
Okay, just a quick follow-up before Kelly jumps in.
Sure.
How do you coordinate with the youth entrepreneurship programs, that are business driven and work with the schools and kind of go in there? Is there a natural connection there, or are these kind of two different things?
You're piquing my interest because that sounds like a natural connection that has not historically been, that would be new to us. But I think that is something for us to certainly explore and consider. Yeah, I would think that's something we can have more extended conversations on, and welcome the opportunity if you have leads, right, for us to connect with folks to see what can be established or built. Again, that convening, that coming together, that sharing of ideas, that brainstorming. Let's do what hasn't been done, right? That's going to serve our young people. That's going to benefit young people. That's going to extend our efforts around prevention. Let's do what hasn't been done. We're willing to have those conversations and be brought to the table.
Okay. Thanks everyone for your questions and answers. Kelly, you want to pick it up?
That would be great. Thank you so much. And I think so. I will kind of pick up where Mark left a question around how, if at all, does or can mentoring in Connecticut connect to all of the work that's being done around disconnected youth? And the short answer is yes, absolutely, it can and should be. And we had dollars last year through the State Department of Education to launch some pilot school-based mentoring initiatives. And so to grow in that space, I think right now the thing that for all of us, I'm sure it's on our minds on a regular basis, is funding and finding more opportunities for funding in an increasingly difficult landscape. Typically in the past, when you've seen one source of funding, such as governmental funding, dry up, you may see corporations step in a bigger way. And right now we're feeling it from both sides. So funding is certainly a concern. And as we go into the 2026 legislative session, I think we can definitely make some great links between mentoring and the work that's been going on over the last, I believe, about 18 months around disconnected youth, and knowing the tremendous outcomes that mentoring has, to be pushing that as a strategy of choice and getting some additional dollars to bring more funding out. Also, I see here in the chat that Caitlin had a question about status updates for the mentoring fund cycle for 2025-2026. And I'm assuming, Caitlin, that you're referencing the Connecticut Mentoring Fund. Is that correct? Maybe Caitlin stepped away for a minute. But
yes, correct. Yes.
Okay. And Roland referenced 2 years ago, we did have funding from a legislative appropriation that we were able to give dollars directly to mentoring programs in Connecticut through a competitive RFP process to help their practices. Unfortunately, we only had 1 year of funding, so it is part of our 2026 legislative agenda to go back on that. And, I think knowing, I'm just going to read into the question that there may be interest in it, that hearing from more than just us as we make those asks will be so critically important. So let me start at the beginning in terms of why we engage legislators in the media. And one of the reasons why I'm so excited to be able to do this is because I sat on the other side. I was a state representative from Manchester a few years ago and have been able to take what I learned sitting on that side of the desk, and I hope have been able to help lift the prevention message in that space as we've continued to advocate for dollars and find those critical champions. I think prevention is one of the uniquest issues that we have because it's both good politics and good policy, and it's totally nonpartisan. It is for everyone. And so we have an opportunity to have such wide and diverse conversations with legislators on both sides of the aisle. And there's really no one who can say, I'm not for prevention. And so you might be thinking, then why isn't prevention more easily and readily funded? And I think we all know the answer because it's hard. It's hard. It's not instant. We have a society right now that is so craves that instant. I see it, I feel it, I know it's working. And prevention is that everyday grind, those little pieces that we know, just unfortunately, we often get forgotten about. And so one of the things that we love to do with the Governor's Prevention Partnership is bring prevention back to the forefront of these conversations, knowing how critical it is, knowing that it's an incredibly smart investment, and reminding legislators of that, because we are sometimes forgotten in that space. We know that for every dollar spent on prevention, it can result in $10 to $18 in future societal savings. That's huge. It's incredibly cost effective to strengthen the communities and protect the youth. And as I think Adam pointed out earlier, an ounce of prevention is worth a pound of cure. So these efforts that we've created over the last several years have really, what we have hoped, helped to lift the tide for all of us. As you may recall, earlier in 2025, there was a 1.7 million suggested reduction of prevention in Connecticut. And we knew that there was no way that the state could sustain it, especially at a time when we're still grappling with the opioid epidemic, when the state has made such tremendous strides because of the work that everyone on this call is doing with the leadership of DMHAS, with the Department of Public Health and other agencies to reduce unintentional overdose deaths. That would have been an incredibly short-sighted cut to the budget. And so we worked really hard to try and make sure that those dollars were restored. They were restored in the budget, thank goodness. Those roles at DMHAS, the dollars that go directly out to community programs were preserved, but that made it really difficult, quite honestly, for us to advance additional efforts for more funding, because we needed to secure what was at home first and do that in a tactful and meaningful way earlier this year. Deb is going to switch over to a video now that shows a little bit of some of the work that we've been doing to engage our legislators and the media. It was a media blitz from earlier last fall.
New push is underway to help stop substance misuse and abuse among youth in Connecticut. The program is called Prevention Starts With You. News 8's Ken Houston joins us from the control room with a look at how the program works.
Governor Ned Lamont is launching this effort. It's a $1.2 million campaign that promotes resources and awareness.
You have the power to help young people who are in your life avoid using drugs and alcohol.
That announcement coming from the Prevention Partnership, co-chaired by Governor Ned Lamont. Organizers say it was created in response to the opioid death of a Hartford middle school student in 2022. They're also calling it a reminder of the daily activities that everyone can do to make sure a difference is made in the lives of young people.
This project will provide 50,000 doTERRA drug deactivation pouches that will deactivate more than 2 million unwanted drugs in Greater Hartford and Greater New Haven.
According to the Department of Public Health, 1,460 overdose-related deaths occurred in 2022, over 125 so far this year. Health experts say home medicine cabinets are a dangerous place for expired medications. They're often flushed down the toilet or tossed into the trash, which is bad for the environment.
Medicine cabinets are ticking time bombs. They are full of stuff that is dangerous. Opioids, painkillers, potentially addictive substances. We need to get them out of the medicine cabinets, get them out of homes, get them off shelves, and dispose of them.
Here's how the doTERRA pouches will be used to dispose of those unwanted drugs.
You just tear up the top, open it. This pouch will render inactive 45 pills or 6 ounces of liquid.
The next step is to get those kits distributed throughout the community, and there are 500 volunteers to get that done. Reporting for News 8, I'm Ken Houston.
So that was what Roland talked about earlier, putting policy into practice. Or practice into policy, I should say. We applied for an earmark through Senators Murphy and Blumenthal. They're now called community project funding. And we were able to bring 50,000 DTERA drug deactivation pouches to homes in Greater Hartford and Greater New Haven during 2024. And we did that by partnering with those that were in the 12 sectors of prevention, whether it was the Connecticut Realtors, we partnered with the city of Middletown, we partnered with Food Share, knowing that prevention is for everyone and that this was an opportunity for us to not just hand out the DTERA pouches, but also to educate people around the importance of prevention. It also came with a public awareness campaign. It came with little talk cards in terms of encouraging adults on how to have the conversations with the young people in their lives around the dangers of drugs and alcohol. And so it's just a small example of how we were able to engage our legislators, draw in some interest from the media. It was a year-long campaign. We were supposed to distribute 50,000 pouches. We distributed almost 60,000. And we have some really strong results to show about how people use the pouches, how they got medication out of their own homes, and just knowing that for us, it was never just about handing out the DTERA pouches. It was around creating a larger conversation and more awareness around the importance of prevention. And because we had this instant tool, and we actually have, we do still have some if anyone needs any, and we can be helpful and partner with community events, we would be happy to do that. This was a time for us to just really open the door and have more conversation at all levels, from the local all the way up to the federal level. We're actually getting an award next week down in Washington from CADCA, as Roland mentioned, which is a national organization that is, well, actually international, the premier international prevention organization that is working with coalitions across the world on prevention. And they are recognizing efforts that we had, not only with the distribution, but also the way we were able to engage legislators and media and have more discussions. And we want to partner with you on these efforts, bring them to your community. We are thrilled, actually, Deb, if you could switch to the next one, that in 14 days from now, we will be starting a week-long Red Ribbon Week campaign where we will be sending out, thanks to the support of the Opioid Settlement Advisory Committee, we will be sending out 50,000 of these pouches to homes with children between the ages of 0 and 17 throughout the state and communities that were most impacted by the opioid epidemic. And so these will be this is a direct mail effort, whereas our last effort was around community distribution, but getting these directly to homes, letting people know that you can save a life, you have the ability to do something. We are never about scare tactics. We are always about providing hope, providing tools, and looking for more opportunities that we can do work together. So again, during Red Ribbon Week, 50,000 of these will be going out. We will be collecting data throughout the process. This is year one. And this is a five-year funded project. And so we will be reaching both English and Spanish speaking homes with English and Spanish speaking materials. And hopefully we'll be just, again, raising more awareness around the need for prevention. And it's about all of us. It's not just because the Governor's Prevention Partnership name is on this. It's what more can we do? How can we partner with you in your communities? How can we respond and meet these needs? Are there opportunities for us to partner on bigger initiatives that, for all of us to really lean into the areas where we can own work and partner, knowing that it's going to make a difference for all of us. One of the things that I really love doing is being able to connect with people about best practices for talking to legislators and connecting with legislators, including our youth. And I know Deb's about to transition to our youth advisory board. And that's one of the areas that we're just so proud of, that giving youth an opportunity to amplify their voice, lead and stand in their own selves with that voice, but finding the best ways to make those connections. And we had a young leader earlier this year who was also recognized by CADCA as their 2025 Youth of the Year for the work that she's been doing. You saw her in our first video, DMHAS, for the work that she did in her community and trying to bring prevention. So it's just, for all of us, it's about bringing prevention to the forefront, having those conversations with whoever we can, whenever we can, wherever we can, and making sure that prevention isn't forgotten. And I'm going to transition it over to Deb for the Youth Advisory Board, unless anyone has questions for me that I can answer.
And we will have more time at the end. All right, I'm going to move on. So as Kelly often likes to say, a well-stocked toolbox prepares you for anything. So we often are trying to add to the toolbox, as we've been mentioning throughout this presentation. So thanks to DMHAS, we do have, for many years now, we've been working to manage the Youth Advisory Board. This is just a quick snapshot of currently we have over 60 members who represent over 40 communities, which is great. It is open to high school and newly graduated youth. So we have some young adults who are part of the Youth Advisory Board as well. And ultimately, through our monthly meetings, through our youth-specific professional development opportunities, they have a chance to develop their leadership skills, public speaking skills, grant making skills, event planning skills, all of that. So if you know of a young person, even if they aren't necessarily part of your LPC or local coalition, feel free to reach out, and we're happy to have them join today. This is actually a picture from an event that we did at just the first kickoff meeting that we had. Most of our meetings are virtual to allow as many people to join as possible across the state. We are now on our 5th year of hosting the Future Prevention Leaders Conference. It will be in June of 2026, number 5. And this conference came together really because, okay, we have these youth, they're involved in the local communities, the youth service bureaus, the local prevention councils, they're part of the Youth Advisory Board. And now what? And so here are just a few snapshots of our future prevention leaders. You know, the youth have the steering committee, so they get to say, what is the goal? What are our primary objectives? They lead sessions, they promote the work that they've been doing in their local communities. It is just a fantastic day, seeing them in action and supporting them. We also do have some parent work that we're doing. The picture of the adults is at one of our most recent community cafe sessions, where the community members themselves really talk about what's important to them, what are they hearing, and what is the problem they want to solve. So we want them to leave the educational sessions with the next steps. You know, what am I going to do next? We also, as Roland mentioned, have our E3 curriculum. These are some photos from a recent training in Norwich with their youth leaders. And after they went through the training and the modules, they've actually implemented E3. They did some activities during National Night Out in August. They're doing things in their schools. It's, again, a way for peers to speak to their peers. And I will go kind of quickly so that I'm looking at the time. So earlier, some folks were asking, how do we reach out? How do we know? Truly go to gppct.org. Right at the top are the trainings and events. There's the URL for that. You're also welcome to reach out to me when I'm done presenting. I will stick my email into the chat and I can help get you to the right people. And we would love to continue this conversation, or if there's somebody that you know couldn't be here today but still wanted to learn more, please join us. Come visit us in November next month on the 6th. You're welcome to come to our office in East Hartford. We also will have a way to make it a hybrid event. This is up on our website, so you're welcome to sign up, show up. We'll be there, and it'll be an informal conversation to continue some of these questions, answers, curiosity, whatever you want to do. You're welcome to join us. And just again, real quick, at the very top of our website or on your mobile phone, if you get to the Get Involved area, you can join our mailing list. You can become a mentor. You can refer a mentee. There's information about the Youth Advisory Board and more. And I would love for folks to be able to take a couple minutes if you have any additional questions, but while you're at it, we have a question to you. This is not an evaluation. This is just curiosity questions. So feel free if you want to join us at menti.com. I'm not going to post it, but you can do that. But are there any questions for me, for Kelly, for Roland? Feel free to speak up. And ultimately, thank you for joining us. I'm going to go back to the Menti meter.
Thanks so much, Roland, Kelly, and Deb for this awesome presentation and sharing everything that GPP is doing just really across dimensions in the state of Connecticut and serving and assisting with all of our prevention efforts here in the state. Thank you for everyone who came today. I'm going to stop recording, and again, I'll send you all of this information, but if anyone wants to hang on after, if you happen to have any questions, feel free to stick around. I'm sure they'll hang for a couple of minutes with everybody, but thank you so much. I'll send you the follow-ups. Thank you for sharing your lunch hour with us, and we look forward to seeing you again soon.
Thank you all.